Everyone, this is Dr. Fox, and let's talk about the facial artery and vein. In this video, we'll discuss the superficial vasculature that serves the face. So let's start with the facial artery. The facial artery, as you likely recall, is a branch of the external carotid artery. So it is going to exit the external carotid, kind of deep to the ramus of the mandible, move anteriorly, and then it comes up over the margin of the mandible. And it usually does so in the vicinity of the pre-masseteric notch. That's not a term that anatomists use. It's actually a term that clinicians use, so there's no real feature of this, but you can kind of palpate a spot just ahead of where the masseter attaches to the mandible, the anterior edge there, and you can palpate the facial artery as a pulse point there. So it jumps onto the face there, and it begins to ascend the face, and its first branch is to the lower lip. We call that the inferior labial artery, and it continues upwards. And the next branch is the superior labial artery to the upper lip. Generally, it's that superior labial artery which is the more robust of the two, but this is vasculature, so I'm never going to say always. And the facial artery will continue upwards. Now we're in that infraorbital or canine space, and it's going to give a branch to the side of the nose. That's the lateral nasal artery. And then it will continue up, and its terminal branch is going to be the angular artery. So it's towards that middle canthus or angle of the eye that it begins to peter out there. So external carotid to the face at the pre-masseteric notch, inferior labial, superior labial, which is more robust, then lateral nasal, and then it's angular all the way up to about the medial angle or canthus of the eye. We can also see, here, let's erase all of this so that it's out of the way. We can also see that the veins are going to mirror the arteries. So, for instance, there is an angular artery. There's also an angular vein. There's a lateral nasal vein. Come down, there's a superior labial vein. There's an inferior labial vein, all draining into that facial vein. Pick that up later. And there's also a deep facial vein. That deep facial vein is going into the buccal space. And more on that later. But, you know, these deep facial veins and angular veins, in this case, represent potential pathways for infections to move deeper into the cranium. So think of the veins as mirroring the arteries, and think of the potential of any infections in these veins to invade the skull. And this is something that we'll discuss more in the context of the cranial cavity and the veins in the cranial cavity. Now that facial vein is going to move through the submandibular space, and we can see that submandibular gland there, and it's going to join up with the anterior division of the retromandibular vein. So recall that retromandibular vein has an anterior and a posterior division. The posterior division meets up with a vein coming from behind the ear, so the posterior auricular, to form the external jugular vein, whereas the facial vein and that anterior division of retromandibular usually form a common trunk, and they're going to drain into the internal jugular vein and carry that blood back down toward the heart. So that leads us to our assessment question of the video. and that is the facial vein typically joins which other vein before draining into the internal jugular vein? Well, it's not that. It's not the angular vein. That's up by the eye. It's not the brachiocephalic. That's in the superior mediastinum. It's not the EJ. It's one of the retromandibular veins for sure. Is it the anterior division or posterior division? Well, the posterior division becomes external jugular vein. It's not that one. It is the anterior division of the retromandibular vein. So D is the correct answer. Facial vein plus anterior division, common trunk, goes into, does not create, but goes into IJ. Thank you so much for your time, and I look forward to talking to you in the next video.